Welcome to this 5-minute introduction to Osteoallograft Orthomix. Orthomix is 100% real bone allograft, which is the gold standard for pre-packaged bone graft materials in veterinary patients and should be used whenever new bone growth is critical. Orthomix is a combination of osteoinductive demineralized bone matrix and osteoconductive cancellous chips. This combination is the perfect formula for successful new bone generation. The native BMPs, bone morphogenic proteins, in the DBM attract and activate stem cells to differentiate into bone-forming cells, while the cancellous chips provide the ideal scaffolding to enable stem cell migration, adhesion, proliferation, and differentiation into osteoblasts. Here are histology slides of VTS demineralized canine bone matrix in a standard osteoinductivity assay. You can see the particles of demineralized bone, stained pink, that were implanted in the thigh muscle of a rat. In order for a material to be considered osteoinductive, 28-day explants must show 4 key elements: new osteoblasts and osteocytes, new osteoid and bone, new bone marrow, and new chondrocytes. As you can see, VTS grafts show all 4 elements required in this osteoinductivity assay. Osteoallograft, in this case a xenograft, is clearly osteoinductive and capable of stimulating new bone formation. No other bone product on the veterinary market can show this type of strong evidence for comprehensive new bone formation. Peer-reviewed publications and case studies using our grafts can be found in the references section of our website. Clinical indications for the use of Orthomix include the following: TTA and TPLO, fracture repair, non or delayed unions, angular limb deformities, arthrodesis, and filling and reconstruction of metaphyseal bone defects. Allograft can be used anywhere accelerated bone healing is required. Here is a case study using Orthomix. This is a 6-pound Chihuahua with a radius ulna fracture. This patient was referred to Dr. Gillis after fracturing distal to the original plate and then refracturing through the site after removal of an external circular fixation. Dr. Gillis replated the fracture, this time adding Orthomix ultrafine bone graft. The particulate Orthomix adds demineralized bone with a very high surface area containing the native BMP growth factors as well as cancellous scaffolding. This resulted in quick bony union. Here are the pre- and post-operative radiographs, as well as the 10-week follow-up. At 10 weeks, the fracture is fully healed. Visit the case studies section of our website to view this and other case studies in their entirety. Real bone allograft can even save the day in a worst-case scenario as seen here. This little Chihuahua was a previous 4-limb amputee who had been abandoned at Dr. Ken Greenwood's clinic with a resorbing fracture repair of the remaining 4-limb. Without real bone allograft to stimulate new bone formation, this could have been a life-ending injury. A surface demineralized allograft rib was used to provide struts to bridge the gap. And again, particulate bone allograft provided a large surface area with exposure of BMPs, which helped to transform the ongoing resorption into new bone formation, effectively saving this patient's only 4-limb. Real bone allograft reliably forms bone in routine situations and even in extremely challenging cases like this one. Allograft is the most effective of all bone graft products available on the veterinary market. Hundreds of bone allografts are used in human surgeries every day. Given the opportunity and understanding, pet owners are often willing to accommodate the cost of quality implants, knowing that their pets are receiving the highest standard of care comparable to that of humans. Orthomix comes frozen or freeze-dried and is available in 0.5 cc, 1 cc, 2, 3, 4, and 5 cc single patient dose sizes. Freeze-dried products are stored at room temperature and have a 5-year shelf life. Someone is here at VTS 24/7 to answer any questions you may have. Our grafts are available directly from VTS and through distributors. Thank you for taking the time to learn about these bone graft products. Now is the time to join your colleagues in using the optimal product for the stimulation of bone healing in orthopedic patients.